تبع الجي اي سيستم. اليوم نبدا journey of microbiology along the GI tract system or module. On this slide, and I did send it to you yesterday, two lectures of today and tomorrow. So we will take the first part of the lecture today, and then we will continue it tomorrow, inshallah, the second lecture. Our subject this morning will be regarding the bacterial infection of the GI tract. But which infection? We are going to talk about the following microorganisms. Helicobacter pylori, sometimes we call it H. pylori. It's hard. The second one, Campylobacter. So today we will deal with Helicobacter pylori and Campylobacter. Tomorrow, inshallah, we will talk about Shigella and Salmonella. Okay? So let us start with the first lecture and start with the first of all, the textbook that is recommended for the microbiology course, not only GI, all third year systems, is this one, which is called Sherry's and Ryan Medical Microbiology. This is the 8th edition. So you can write it is the 8th edition. لأن اللي بعثت لكم إياها كانت شوي يعني اللي قبليه 7th edition. This is the latest edition. بس اللي ما عنده أو ما يقدر يحصل عليه, the 7th edition will do the same job. It's very good book, textbook, international. Many medical colleges adopting this book. تكنو أيضا يستعملون نفس الكتاب. So it's very nice. This is the 7th edition. The one that I have shown is the 8th edition. الطبعة الثامنة, هذا الطبعة السابعة. Now, the learning objective of this lecture will be to understand Helicobacter pylori in gastritis. Helicobacter pylori سبب التهاب المعدة اللي هو gastritis. Peptic ulcer disease, قرحة المعدة والاثني عشر. It is called peptic ulcer disease. And also gastric adenocarcinoma. تصوروا هذه الجرثومة تلعب دور كبير في ظهور الادينوكارسينوما في المعدة. فإذا very important microorganism. It is related to adenocarcinoma of the stomach and also to the mucosa-associated lymphoid tissue lymphoma. So as well as the lymphoma that will be seen at the gastric area. The second thing is to understand laboratory diagnosis and antibiogram. Antibiogram, it means the antibiotic sensitivity of the microorganism. يعني which antibiotic will kill the microorganism. This is called what? Antibiogram. Number 3, to recognize the morphology, culture, and pathogenesis, and the role of bacteria, Campylobacter, Shigella, and Salmonella. Each lecture, classically, we talk about morphology, we talk about culture, we talk about laboratory diagnosis, epidemiology sometimes, and also the antibiogram, as I mentioned. Appreciate the epidemiology of and the microorganism. When I say treatment, I am not to talk about pharmacology. You will have the same drugs I probably discussed to you from pharmacokinetic point of view, or from pharmacodynamic point of view. Absorption, excretion, dose, etc. Side effects. هذا مو microbiology. In microbiology عندي بكتيريا. which antibiotic يأثر عليها؟ هذا هو. فإذا الميكروبيولوجي something different. بعض الطلاب بيتصور انه احنا بيننا وبين الفارماكولوجي overlap. There is no at all overlap between us, but only the name. And you will have the same names when we talk in medicine, inshallah, next year. Okay, so antibiotic مو معناته إذا ذكرت هون معناته نعيد الفارماكولوجي. لا، هذا نشوف هذه الجرثومة ايش يأثر عليه؟ ايش sensitive وايش resistant. هذا هو اللي احنا نحكي فيه. So epidemiology and the treatment. So remember, a treatment is the effect of drugs on the microorganism. That's it. No absorption, no side effect, no, etc. This will have it in your pharmacology. So let us start with the Helicobacter pylori. First of all, this microorganism is gram-negative. Helix shape, spiral, لولبية. Also, this microorganism is motile, 4 to 6 polar flagella. وراح نشوف الصورة كيف عندها polar flagella. نشوف الفلاجيلا نتحرك فيها 4 to 6 هاي الفلاجيلا للحركة for swimming. Okay? So this microorganism motile and it has microphilic. This microorganism requires microphilic environment. And we will talk about the microphilic environment while we are going to discuss. The organism is highly specialized to exist in acidic environment. As you know, the stomach is very acidic. The pH is about 2 to 3. Very, very acidic. تصور microorganism تقدر تقاوم هالاسيديتي الرهيبة. And this microorganism has very special characters that we are going to talk about it. How is going to tolerate such acidic pH? The other thing, it can change its membrane potential, the pH, from a 3 to 7, and adapt itself to the environment that it exists. So it can tolerate pH up to 3, down to 3, but can change its potential up to 7. So very exciting characteristic. It uses many virulence factors, and we will talk about the virulence factor. Very important. The most important part of this lecture are the virulence factors of H. pylori. But just to mention 2 points. First of all, this microorganism has urease enzyme and also has a flagella for motility assays. The urease enzyme can increase the pH of the surrounding, and you will see how in a moment. The pH الأسيد ترفع تعمل 4 و5 و6. It can have molecular mimicry to the host, so it can evade تتجنب the immunological response. شوفوا كم قابلية عندها الجرثومة. شايفين؟ So we will go further with this microorganism, and Warren and Marshall مو كثير قبل 40 سنة أقل من 40 سنة. Warren and Marshall identified in 1983 these microorganisms in relation to gastritis and peptic ulcer. So because these are microorganisms, so gastritis and peptic ulcer disease can be considered as infectious diseases. ليه؟ تعديل النقل. These people, the two, Marshall and Warren and Marshall, awarded the Nobel Prize later on for this discovery, which is very important, a breakthrough. Right. H. pylori has similarity to Campylobacter jejuni. And even before 1983, they were in the same genus, and they were called Campylobacter pylori, and these were in the same genus. Okay? But later on, they are separated into two genera, Campylobacter and Helicobacter, and because they are different in morphology, cultural requirement, and motility. They are similar in morphology, similar in morphology, cultural requirement, and motility, but they are different in genetic point of view. For example, Campylobacter is urease negative. H. pylori is urease positive. H. pylori, as I said, urease positive, which raises and increases the pH, and it has very important virulence factors. For simplicity, we call them VAG, GAG, OPOA, OA. What is VAG? Vacuolating cytotoxin A. This causes injury of lysosomal and endosomal membrane of the cells. So when they infect cells, they injure these membranes and cause death of the infected cells. The GAG, this one, cytotoxin-associated gene A protein, can cause alteration in the cytoskeleton of the cell and also lead to damage. You know, the cytoskeleton is the shape of the cell. So it acts on actin, for example. مادة اسمها actin تعطي shape للخلية. They destroy it, so the cell will go into damage, severe damage. Adhesin, VAB-A, and another one, outer membrane protein, A, OA. So VAB, GAG, VAB-A, and OA. 4 factors, very important. You have to know exactly what's the action of each one, right? وراح نعرف السبب ليش لازم احنا نتعلم هاي الاشياء. هاي صورة شفناها سوبرام نيجاتيف سبايرال مايكرو ايروفيليك and motile. يعني انا ممكن اجيب سؤال multiple choice بهاي الصفات اكسب. صح؟ لازم واحد يعرفها. Epidemiology of H. pylori. H. pylori can exist in about 25 إلى 50% in the developing countries. الناس العاديين they carry this microorganism بنسبة 25 إلى 50%. تقريبا نص الشعب يعني يحمل الجرثومة. بالدول المتقدمة developed countries. In developing countries في منطقتنا في الشرق الأوسط may reach up to 90%, 75 to 90% وأكثر. 95% you can say 99. أنا لو أخذكم ولا كلكم سوي إحصائية أقل شيء 95% منكم يحمل هاي الجرثومة in this stomach. السؤال اللي راح ينثار ليه بعض الناس بتنصاب بالجاسترايتس والبيبتيك ألسرز وفي ناس تحملها وكل شيء ما بيها؟ هذا راح نجاوب عليه بالمحاضرة. جزء من الجواب على هذا تعتمد على الفيرولنس فاكتورز جاك اوكي هذه الفاكتورز اللي حكينا عليها if it's present or not present in the microorganism. Now this microorganism is related to, as I said, gastritis, gastric duodenal ulcer, gastric adenocarcinoma, gastric mucosa associated lymphoid tissue, MALT, lymphoma. For simplicity, they call it maltoma. هي lymphoma because it is related to mucosa associated lymphoid tissue. WHO consider H. pylori as class 1 carcinogen. Why class 1 carcinogen? Because it can result in adenocarcinoma. It can result in a lymphoma. Then WHO consider it as carcinogen. حكينا هاي diseases أيضا infectious diseases at the same time. As a pathogenesis of the microorganism, first of all, motility. So motility can move the microorganism around the stomach, and we will see the details in a moment. Secondly, urase positive, and we have seen the effect of the urase. Number 3, adherent. It can adhere to the body tissues like the stomach or the duodenum. Any microorganism, خلوها قاعدة عندكم بالميكروبيولوجي. Any microorganism cannot adhere, cannot cause a disease. Attachment تعمل بعدها الديزيز. بدون attachment ما فيش. Other valves, gag حكينا عليها. تمام؟ cell death وcytoskeleton. Colonization يعني قديش تتواجد المايكرو اورجانيزم بالمعدة مثلا. variable يعني مو كل الناس على قياس واحد. It could be minimum, could be extensive. Ulcers, you remember the first lecture, introduction. I said the gastric ulcers mainly at the antrum. تمام؟ peptic ulcers, gastric ulcer, كلمة peptic ulcer تعني gastric ulcer and duodenal ulcer. فمكان ما نحكي gastric ulcer and duodenal ulcer نقول peptic ulcer. بس البيبتيك ulcer نوعين gastric و duodenal. الجاستريك وين تصير؟ بالانترم. Okay? While in the duodenum, mainly in the duodenal bulb. تصير بغير مكان؟ نعم. بس commonly I am saying commonly. Okay? Now, metaplasia leading to cancer. long infection, irritation للcells will lead to what? Metaplasia. أي مكان يصير فيها irritation لفترة طويلة it's prone to metaplasia. The role of GAG-A and long time inflammation, and also this microorganism can affect certain hormones controlling the glucose. So there is a recent theory it may be related to diabetes mellitus. This is under research work. Not sure, but there are theories saying that it may be related to diabetes mellitus. Now here we can see the microorganism with polar flagella, motile, at the gastric lumen. الPH 1 إلى 2 أو شوي أكثر. can tolerate. هالمايكروأورجانيزم شو تساوي؟ escape from this very strong acidity. Escape. Where it can escape? To the mucin layer. تعرفوا جدار المعدة مغطى بمادة الميوسين، مادة مخاطية لحمايتها من الإيش؟ من الأسيديتي. Now it can escape from here and go underneath the mucin layer which has a pH 7 to 8 حتى تخلص من الأسيديتي. And this will be helped with what? With urease. Urease will increase the pH. And I will let you know how in a moment. Okay? Now this microorganism can enter into the cell by type 3 secretion system, تعمل attachment وتفرز الفيرولنس فاكتورز تبعها الجاك والفاج etc. Okay? So VAG and GAG, and there will be vacuoles inside the cell, cause injuries to the cell, as I described, and cytoskeleton damage, so the infected cells will die, and the microorganism can escape underneath these cells, and this will be surrounded by cells, immune-competent cells, like neutrophils and lymphocytes. Infiltration, just to contain the infection. This microorganism cannot reach to the blood. It's in the mucosa and in the submucosa. That's it. Cannot reach to the blood. And if the ulcer stays for a long time, it may cause perforation of the stomach or the duodenum. Right? Cause what? Perforation. And the bleeding, excessive bleeding. So there will be cellular infiltrate around. هسه شفنا الميكروأورجانيزم الفلاجيلا urease can break urea into ammonia. الأمونيا حامضة لو قاعدة قاعدة ولهذا يعلم كثير. تمام؟ Now by type 3 secretion system, VAG, GAG, VAG, all enters into the cell and cause damage to the infected cell. And these cells will die again. And there will be ulcers. And the ulcers may break and cause perforation and bleeding. هسه نشوف هذا المكان جالسة الميكوزا شوف الميكرو اورجانيزم هاي كيف تكون نيجاتيف السيلز هذه ديد وفاكيولز فيها نتيجة ايش؟ نتيجة الفيرولنس فاكتورز اللي حكينا عليها. الميكرو اورجانيزم هذه في الجدول او في الصورة يعني تختصر لنا اليورين lipopolysaccharide الفات الجاج there are enzymes, mucinate, protease, lipase, all can damage motility. All these can damage the host cell. Look here, the gas actin remodeling. It affects the actin, the cytoskeleton. Actin is part of the cytoskeleton. And it can induce interleukin-8 production and host cell growth and apoptosis inhibition. The role of immunity, the role of natural immunity is limited. As you know, microorganisms get virulent. الباثوجينيسيس تبعها كلش عالي. فالإنيت immunity limited value. يعني الإنيت immunity مثل إيش؟ الجازيك acidity is part of the innate immunity. Okay? That is also immunosuppressor. That is why I said in the beginning, it can evade the immune system. تتجنب the immune system, can escape from the immune system. The clinical aspect of H. pylori diseases, it could be asymptomatic. شخص ما يعرف. مصاب 6 سنين عنده. خاصة في كبار السن. Okay? Could be asymptomatic. Could be symptomatic. Abdominal pain, nausea, vomiting, etc. Gastritis and peptic ulcer disease, and may lead also to what? To perforation, ulcer, okay? And it breaks some mucosa and cause perforation. يعني ممكن يجينا الشخص ما كان يعرف نفسه خاصة في كبار السن لأول مرة with the bleeding. الكلينيكال كبسول فإذا احنا راح يكون عندنا بالمحاضرات وفي كتابكم أيضا موجود شيء مربعات هيك ومستطيلات اسمها كلينيكال كبسول. This is very important. Everyone should read it very carefully. Some questions will be both based on these clinical capsules. Look now, Helicobacter infections are limited to the mucosa of the stomach. Mucosa. Okay? And most are asymptomatic after many years of infection. It may cause burning pain in the upper abdomen. ألم في البطن. burning مثل زي الحرقة. Okay? Accompanied by nausea and vomiting. لعيان and إرجاع. Okay? And ulcers may cause additional symptoms. Depend on the location of the ulcer. وراح اتركها للميديسن ان شاء الله السنه القادمه يكون عندنا محاضرات على البيبتيك ulcer diseases. At the end I will have your questions all. It is common for gastric and duodenal ulcer to be unrecognized until the patient come to you with bleeding. Perforation and bleeding. يعني يجي مثلا رجال كبير دائما عمره كبير والله توجعني بطني من هون والله عندي الأعيان مين ما توجع بطنه ومين ما عنده الأعيان. Very common signs and symptoms. Very common. فواحد ما ينتبه and it will pass unrecognized for many years. الحج كبير بالعمر وكذا والله يابا انت اليوم سجلت بالاكل بتمشي ان شاء الله. فيجينا يوم our patient will come to us with a bleeding and perforation. which is an emergency. If not treated, the patient will die in a few hours. Diagnosis, we can take biopsies from the stomach or the duodenum. بناخذ البايوبسي نتذكر انه هاي مايكرو اورجانيزم it may cause adenocarcinoma and lymphoma. So we take multiple biopsies just to exclude cancers. So biopsy in microbiology from gastric mucosa, البايوبسي هذا شو نعمل به؟ نعمل به كلتشر نزرعها عارفين انتم الكلتشر ونعمل منها rapid urase test. ناخذ قطعة small piece of the biopsy طبعا ناخذها بالناظور البايوبسي by endoscope اللي حكينا عليه المرة اللي فاتت. Okay, we take a small biopsy and then we do urase test, rapid urase test. This microorganism has strong urase, so it will change the color of the media within less than 5 hours. بينما أي microorganism أخرى, it cannot be as rapid as H. pylori in changing the color. So rapid urase test. There is another one, urea breath test. لازم تفرقون بين هالفحصين. Rapid urase test وurea breath test. راح أتكلم عن urea breath test in the next slide. Okay? Also, we can detect antibody. When you detect antibody or antigen, we call it serology. We can detect the antigen بواسطة الantibody, and we can detect the antibody بواسطة الantigen. Vice versa. This is called serology. So we can detect a specific IgG and IgA in chronic cases, long infection, and also we can detect the ammonia نتيجة البريك okay مع اليوريا بواسطة اليوريز in the urine. And I will come back to this point in the next slide. هسه نشوف هذا السلايد. هسه عندي يوريا. المايكرو اورجانيزم شو؟ يوريز بوزيتيف. It can break urea. تمام؟ into what? Into ammonia and CO2. We give the patient small amount of urea just to ingest it, but the urea here are labeled with radioactive isotope. مادة مشعة. It's called carbon 13. Okay, carbon 13. The CO2 هذا, this CO2 that comes will be labeled with the carbon 13 مادة مشعة. ال CO2 راح ينسحب على الريسبيراتوري تراكت. تمام؟ فبنحط جهاز على الفم قبل الفحص وبعد الفحص نشوف الراديو اكتيفيتي. اذا زادت معناتها في اتش بايلوري، ما زادت معناتها نور. فكره بسيطه مو؟ هذا شو اسمه؟ يوريا بريث تيست. وفرقوه عن الرابد يوريس تيست. اوكي؟ هسه نعم؟ لا مو زياده. كميه من اليوريا يشربها او يبلعها المريض، وتقيسين الفحص قبل ما ياخذ وبعد ما ياخذ، وتشوفين كميه الراديو ايسوتوبس نتيجه السي او 2. نفس العمليه for the ammonia in the urine. iron and ammonia, we can detect it with this one. Okay? Also, so breath test, CO2. In your blood, we can detect antibodies, IgG, against H. pylori. As you know, the microorganism is present in the stomach. It may be broken by the enzymes of the GI, broken by the acid of the stomach. Some of the H. pylori antigen will appear in the stool. So we can detect the antigen of H. pylori in the stool. مفيدة عندنا بمجتمعاتنا؟ الجواب لا. فوق 90% نسبة الإصابة. يعني كل واحد راح تعمل له الفحص راح يطلع بوزيتيف. في أوروبا مفيدة. بس يفيدنا متى؟ لو عالجنا المريض صار نيجاتيف معناته كيور. تمام؟ الفكرة يعني واضحة. The treatment multiple therapy. نعم. يعني بعد المحاضرة شدي يسأل. treatment multiple, triple or quadruple therapy. مو pharmacology. أنا ما راح أحكي pharmacology. شو هي الدراج؟ بروتون بامب انهبيتور. عارفين شو هي البروتون بامب انهبيتور؟ مو؟ اللي تقلل الاسيديتي مثل لازابرولول. اوكي؟ لازابرولول. اوكي؟ these proton pump inhibitor. And we can give two antibiotics. شو الانتيبيوتيك؟ clarithromycin plus amoxicillin or metronidazole. شو هو المترونيدازول؟ فلاجيل. الخيار الثاني عندي alternative ليفوفلوكساسين، واحد من النيو جنريشن من الكينولونز، زوروكينولونز، عملوه درس الكيمياء بالجنرال. تمام؟ مايكروبيولوجي. levofloxacin or tetracycline plus metronidazole. So a triple therapy, two antibiotics, وبروتون بامب انهبيتور، شو يصير عندنا ثلاث. أعطيناه للمريض صار أوكي خلاص. بعده يجي لك abdominal pain, nausea, vomiting، تنطيه دراج رابع اللي هو business subsalicylate اللي هو بيتو بيزمول. هذا هو البيبتو بيزمول. The cure rate is very high, above 90%, 95% the cure rate. يعني regimen treatment ممتازة جدا. The prevention, the patient should follow hygiene, good food, etc. And a prophylactic treatment of asymptomatic person should عالج 90% من الشعب under question mark. يعني نسبة عالية للبروفيلاكسيس. هسه الكامبايلوباكتر second microorganism. Now Campylobacter morphology S-shape spiral seagull like. seagull شو معنى seagull؟ طائر النورس، مثل جناح طائر النورس. هسه نشوف. Okay, seagull نورس. Similarity to H. pylori, the previously called Campylobacter pylori. Right? And now separated because of the difference. Campylobacter jejuni, there are many species. وبالمستشفيات ما مطلوب أن نفرق بين السبيشيز، خاصة في two species Campylobacter jejuni، Campylobacter coli. لا يستوجب التفريق بينهم لأنه التريتمنت نفس التريتمنت ونفس الريزلتس. أوكي؟ فما نفرق بينهم. Campylobacter can cause enteritis. شو enteritis معناتها؟ Inflammation of the intestine. Campylobacter enteritis. شو معنات enteritis؟ التهاب الأمعاء. And we call it campylobacteriosis. شو معنات campylobacteriosis؟ معناتها infection of the intestine. Cultural characteristics, they are microaerophilic. راح نتعلم شو معنات microaerophilic. Capnophilic and thermophilic. Thermophilic, it means can tolerate temperature 42 degrees centigrade. Usually microorganisms tolerate 37, 38. Very limited numbers of microorganisms can tolerate temperature of incubation بالincubator الحاضنة up to 42. Pseudomonas aeruginosa can tolerate 42 degrees centigrade. Okay, Campylobacter jejuni تتحمل حرارة 42. It can use carbohydrate amino acid by the microorganisms. They have toxin, very important toxin. حكينا عن التوكسين تبع الاتش بايلوري. هسه Campylobacter عندها cyclolethal distending toxin. CDT cyclolethal distending toxin. Also, it has lipopolysaccharide, lipo-oligosaccharide, lipopolysaccharide. These are part of the pathogenicity of the microorganism. Cultural characteristics. هسه نتعلم. What is the meaning of microaerophilic? Microaerophilic, you provide nitrogen 85%, CO2 10%, and oxygen 5%. يعني تتحمل كمية قليلة من الأكسجين، كمية أكثر من CO2، وحتى نعوض مكان بقية الغازز you put nitrogen 85%. شو نسميها هذه؟ مايكرو ايروفيليك. لو سألتكم شو المايكرو ايروفيليك؟ اكسير تعرف. ها؟ This can be provided by gas generating kit. gas generating في ظرف هيك صغير يجي جاهز للمختبر من شركات يعني معينة. We put water in it. We cut part of the top of the sack, we put water, and we put it in jar. This is jar, element, okay? And this will provide for us, this sack provide for us the microaerophilic environment. يعني كيس صغير أطوي 10 ml of water and will provide for us the microaerophilic environment. Secondly, capnophilic. It requires 10% CO2. Capno, it means CO2, okay? And thermophilic, I discussed it 42 degrees. Biochemical, and we have to differentiate it from H. pylori. There is similarity عالية. Both of them catalase positive, oxidase positive. وعارفين انتوا الكاتاليز العام الماضي خدتوها بالجنرال مايكروبيولوجي، صح ولا لا؟ Catalase and oxidase. But the difference where in the urease. Excellent. Good. So urease negative, the Campylobacter H. pylori positive. And you have to be aware about this point. This is Campylobacter. You can see similar to the seagull, Pyranoris. بالنسبة لجناح Pyranoris هذا هو Pyranoris. صح؟ So seagull shape. Epidemiology, the rate of infection to cause diarrhea. Enteritis شو معناتها التهاب الأمعاء؟ معناتها diarrhea. 4 to 40%. In US, for example, the most important microorganism causing diarrhea is Campylobacter jejuni. Okay? Secondly, the primary reservoir, non-GI microorganisms from animals, like wild animals, sheep, cattle, chicken, birds. So, especially the chicken, poultry, الدواجن تنقل عن طريق الدواجن خاصة إذا ملوثة. يعني رقم واحد in causing diarrhea in USA is what? Is the Campylobacter. So transmission by uncooked poultry and unpasteurized milk. So if it is transmitted from animals, it means it is zoonotic disease. So the diseases that are transmitted from animals to man are all called zoonotic disease. So Campylobacteriosis is a zoonotic disease. All right. Immunity can be acquired after development of infection. As you know, after infection, immunity, the immune system will be stimulated. So the immunity will be protected. IgA, secretory IgA in the intestine can protect, can prevent attachment, can prevent invasion of the microorganism. This secretory IgA. Cellular immunity is also important to control those microorganisms. Pathogenesis, first of all, as I said previously, adherence. Any microorganism that cannot adhere cannot cause a disease. Secondly, invasion of enterocytes and microtubules of the cells. Enterocytes, it means the cells of the intestine. And damage to the infected cells by what? By the cytotoxin, the standing toxin. Okay? So CDT and lipo-oligosaccharide. This microorganism, after infection, there will be antibodies formed against it. These antibodies may cross-react with the myelin sheaths of nerves in the central nervous system. You know, every nerve is coated with myelin sheaths. The antibodies will attack. The antibodies these antibodies are against the Campylobacter, but to cross-react with the myelin sheath and cause damage to the myelin sheath, and this will result in a syndrome which is called Guillain-Barré syndrome. And we will talk about it later on in the central nervous system. Now, it is an acute demyelinating neuropathy, Guillain-Barré syndrome. It's a complication of Campylobacteriosis. It is type 2 hypersensitivity due to molecular mimicry, تشابه molecules by the anti-lipo-oligosaccharide antibodies. The clinical capsule, as I said, you have to pay attention to the clinical capsule. The clinical capsule, Campylobacter jejuni, can infect the intestine and cause lower abdominal pain. Usually it is self-limiting disease. It will end by itself without any treatment, within a few days up to 1 week. Sometimes it can be severe and cause dysenteric diarrhea. The word dysentery in medicine, it means diarrhea with blood and pus. دم وقيح. When you say dysenteric diarrhea, it means diarrhea with blood and pus. So Campylobacter is one of the causes of bloody diarrhea. we will have other microorganisms in our system and other systems causing a bloody diarrhea. One of them is Campylobacter. Okay, remember it. And sometimes it may be quite severe and may stay more than 1 week, and in that case, it requires treatment. The clinical aspect of campylobacteriosis: the course of the disease, abdominal pain, dysentery. Diagnosis usually clinical, and we may require to do laboratory investigation as culture for the microorganism. Culture of the microorganism is easily done. The treatment, usually no need for treatment. As I said, self-limited. But if it is severe and stays more than 1 week, in that case we have to use antibiotics in case it stays more than 1 week. What are the best antibiotics? Look here, we are talking in microbiology. The best antibiotic or the antibiotic of choice will be erythromycin or azithromycin, which is the long-acting erythromycin. The fluoroquinolones may be used in resistant cases, especially in patients who are HIV positive. Okay? Human immunodeficiency virus positive. These microorganisms are resistant to beta-lactam ring antibiotic. You know the beta-lactam ring antibiotic, which has the beta-lactam rings, like penicillins, cephalosporins, meropenem, etc. This microorganism is resistant to them. So don't give penicillin or cephalosporin in case of campylobacteriosis. The drug of choice will be azithromycin or erythromycin, and in certain severe cases will be levofloxacin or fluoroquinolones in case of HIV infected patients. Any question? No. The black stool, that is blood in the stool, or blood in the stool. The black stool, when we have a black stool, it means upper GI bleeding. In order to the RBC to be digested, and then if you have a black stool, it means something from the stomach or the kidney. ما يصير يصير perforation ويصير vomiting ويصير frank vomiting. بعد مين عنده سؤال؟ تقريبا يعني هي مو normal flora بس you are carrier of a pathogenic microorganism, and this will depend on your genetics, your tolerance, and on the virulence factors that the microorganisms carry. Okay, I have to stop here, and if you have any questions, you can email me or